What if I told you that right now, as you're watching this, your body might be sending you warning signals about cancer that you're completely ignoring? Here's something that will shock you. Every single day in America, over 1,600 people over the age of 60 receive a cancer diagnosis. That's more than one person every minute. But here's what's even more alarming. Many of these cancers could have been caught months or even years earlier if people had recognized the early warning signs their bodies were desperately trying to show them. Most people dismiss these signs as just getting older, but that's a dangerous mistake that could cost you everything. The difference between catching cancer early versus late can literally mean the difference between a 90% survival rate and a 10% survival rate. I'm going to share with you the 7 most important early warning signs that you absolutely cannot afford to ignore, and the most crucial tip that could save your life is coming at the very end, so please don't miss it. Now, I know talking about cancer is scary, especially when you're over 60 and you're watching your friends and family members getting diagnosed left and right. But here's what gives me hope, and what should give you hope too. When cancer is caught early, the outcomes are dramatically different. We're not talking about small improvements here. We're talking about the difference between a full, healthy life and a devastating diagnosis that comes too late to treat effectively. I want you to do something right now that will help me understand who I'm talking to. Write your age in the comments below. I read every single comment, and I reply to as many as I can. I want to know how old you are because the advice I'm sharing applies differently depending on your exact age, and I might have specific guidance just for you. Let me start with something that happens so gradually. Most people never notice it until it's too late. Unexplained weight loss might seem like a blessing, especially if you've been trying to lose weight for years. But when you're losing weight without trying, without changing your diet, without exercising more, that's your body waving a red flag that something is seriously wrong inside. Here's what's happening that you can't see. Cancer cells are incredibly hungry. They consume enormous amounts of energy, and they're literally stealing nutrients from the rest of your body. When you lose more than 10 pounds in 6 months without trying, especially if you're over 60, that's not your metabolism finally cooperating with you. That could be pancreatic cancer, lung cancer, or stomach cancer announcing their presence in the most subtle way possible. The scary truth is that by the time unexplained weight loss shows up, cancer has often been growing for months. But here's what you can do starting today. Weigh yourself at the same time every week, wearing the same type of clothing, and write it down. If you notice you've lost more than 5 pounds in a month without trying, that's your signal to call your doctor immediately. Don't wait. Don't make excuses. Don't assume it's a good thing. Now let me tell you about something that's even more overlooked, and it's happening to thousands of people right now who have no idea they're in danger. Persistent fatigue that doesn't go away with rest is not just part of getting older. Yes, you might not have the same energy you had at 30, but if you're sleeping 8 hours a night and still feeling exhausted every single day, if simple tasks that used to be easy now leave you feeling drained, your body is trying to tell you something critical. Cancer-related fatigue is different from normal tiredness. It's the kind of exhaustion that sleep doesn't fix, that rest doesn't improve. It happens because cancer cells are hijacking your body's resources, and your immune system is working overtime trying to fight something it can't quite identify yet. Leukemia, lymphoma, and colon cancer often announce themselves this way, sometimes years before any other symptoms appear. Here's what I want you to do. For the next 2 weeks, rate your energy level every evening on a scale of 1 to 10, with 10 being the most energetic you've ever felt. If you're consistently rating yourself below a 5 and you're getting adequate sleep, it's time to have a serious conversation with your doctor about blood work and further testing. This next warning sign is so common that almost everyone experiences it at some point, which is exactly why it's so dangerous. Changes in bowel habits might seem embarrassing to talk about, but they could be saving your life. I'm talking about persistent diarrhea, constipation that won't resolve, stools that are consistently thinner than usual, or blood in your stool that you might be attributing to hemorrhoids. Colorectal cancer is the third most common cancer in people over 60, and it's also one of the most preventable if caught early. But here's the problem. The early symptoms are so similar to common digestive issues that people ignore them for months or even years. That occasional blood you're seeing and blaming on hemorrhoids could actually be a tumor that's small enough to remove completely if caught now, but deadly if left alone for another year. Your colon is trying to communicate with you every single day. When something changes and stays changed for more than 2 weeks, that's not normal aging, that's not just stress, and that's not something you should handle with over-the-counter medications. If your bowel movements have changed in frequency, consistency, or appearance, and these changes persist for more than 2 weeks, you need a colonoscopy, not more fiber supplements. Here's something that might surprise you, and it's particularly important for the women watching this. A persistent cough that won't go away, especially if you're a former smoker or if you've never smoked at all, could be lung cancer developing silently in your chest. Most people think lung cancer only affects heavy smokers, but that's a myth that's costing lives every single day. Non-smokers account for about 20% of lung cancer cases, and the numbers are rising, especially among women over 60. The cough starts innocently enough. Maybe you think it's allergies, maybe you blame it on the weather or dry air. But when a cough persists for more than 3 weeks, when it's accompanied by shortness of breath during activities that used to be easy, or when you occasionally cough up blood, your lungs are screaming for attention. Here's what makes this particularly tricky. Lung cancer symptoms often develop so gradually that you adapt to them without realizing it. You might start avoiding stairs without consciously deciding to. You might find yourself getting winded during conversations without connecting it to anything serious. Pay attention to these subtle changes. If you're coughing for more than 3 weeks, or if you're more short of breath than you were 6 months ago, don't wait for it to get worse. Now I want to talk about something that's hiding in plain sight on your skin. New moles or changes in existing moles are your skin's way of warning you about melanoma, and this is especially critical if you're over 60 because your lifetime sun exposure is finally catching up with you. But here's what most people don't realize. Melanoma can appear anywhere on your body, even in places that have never seen the sun. The ABCDE rule could save your life. Asymmetry, border irregularity, color variation, diameter larger than a pencil eraser, and evolution or changes over time. But there's something even more important that doctors are now recognizing. Any new mole that appears after age 50 should be examined immediately. Your body shouldn't be creating new moles at this stage of life, so when it does, that's a red flag. Here's your action step. Once a month, examine your entire body in a well-lit room with a full-length mirror. Use a hand mirror to check areas you can't see easily. Take photos of any moles you're concerned about so you can track changes over time. If you notice any mole that looks different from your others, or if you have what dermatologists call an ugly duckling mole, see a dermatologist within 2 weeks, not 2 months. Let me tell you about a warning sign that's particularly cruel because it often affects one of the most important aspects of your life at this age: your ability to swallow comfortably. Difficulty swallowing, especially if it's getting progressively worse, could be esophageal cancer, and this is one of the most aggressive cancers we see in people over 60. It starts so subtly that most people adapt without realizing what's happening. Maybe you start chewing your food more carefully. Maybe you switch to softer foods without consciously deciding to. Maybe you find yourself drinking more water with meals to help food go down. These aren't just signs of aging. They could be signs that a tumor is growing in your esophagus. Esophageal cancer is particularly dangerous because it often doesn't cause symptoms until it's advanced. But difficulty swallowing is one of the earliest signs we can catch. If you're having trouble swallowing solid foods, if food feels like it's sticking in your chest, or if you're experiencing pain when you swallow, don't adjust your diet to accommodate these symptoms. Get them evaluated immediately. The final warning sign I want to share with you is something that affects millions of people over 60, but it's so normalized that almost everyone ignores it. Persistent heartburn or indigestion that doesn't respond to over-the-counter medications could be stomach cancer, and this is especially important if you have a family history of gastric cancer or if you've been infected with H. pylori bacteria. Here's what's particularly insidious about this. Stomach cancer symptoms are almost identical to common digestive problems that many people over 60 experience regularly. The difference is persistence and progression. If your heartburn is getting worse despite medication, if you're feeling full after eating very small amounts of food, or if you're experiencing nausea and vomiting along with your digestive symptoms, your stomach might be trying to warn you about something much more serious than acid reflux. Don't let age discrimination in healthcare work against you. Too often, doctors dismiss symptoms in older patients as just part of getting older, and too often, patients accept this explanation when they should be demanding further investigation. If your digestive symptoms have changed or worsened over the past few months, insist on proper testing, including blood work to check for H. pylori, and potentially an endoscopy, to visualize what's actually happening in your stomach. Now let me bring all of this together for you, because I know this information can feel overwhelming, and that's not my intention. My intention is to empower you with knowledge that could literally save your life. The most important thing to understand is that your body is constantly communicating with you, and at 60 and beyond, you need to become fluent in this language. Cancer is not an inevitable part of aging, and early detection changes everything. When we catch cancer early, we're not just talking about treatment. We're talking about cure rates that should give you tremendous hope. Stage 1 cancers have cure rates of 80 to 90% or higher, depending on the type. Stage 4 cancers have survival rates that are dramatically lower. The difference between these stages is often just time. Time spent listening to your body, and time spent taking symptoms seriously. Your body has an incredible ability to heal and recover, even after 60, even after 70, even after 80. But it needs your partnership. It needs you to pay attention, to take symptoms seriously, and to advocate for yourself when something doesn't feel right. You know your body better than anyone else, and when something changes and stays changed, that's your cue to take action. Remember, even small changes in how you monitor your health can have enormous impacts on your outcomes. Weighing yourself weekly, doing monthly skin checks, paying attention to persistent symptoms, and most importantly, refusing to accept you're just getting older as an explanation for significant changes in your health. These simple steps could be the difference between catching something early when it's treatable and missing the window when early intervention could save your life. If this information has been helpful to you, please hit the like button and subscribe to stay updated with more health content specifically designed for people over 60. Turn on notifications so you never miss important health information that could benefit you or someone you love. And please share this video with your friends and family members who need to hear this message. You might literally be saving someone's life by sharing this information. I want to hear from you in the comments. Which of these warning signs surprised you the most? Are there other health topics you'd like me to cover in future videos? Remember, I read every comment and I reply to as many as I can, so don't hesitate to reach out with your questions or concerns. Your health is worth fighting for, and you're never too old to take control of your well-being.